Hey, today webinar is such an important. There's the two important subjects you have to got to know. One, talk about high blood pressure, and then second is prostate cancer. Now, a lot of people say, "Wow, high blood pressure." Yes, that's very important because that affects your heart, your brain, and I can tell you some story which is going to be really get you to understand that you gotta measure your heart high pressure every day in the morning, in the afternoon, and evening. There's a reason because if not, you didn't measure, you don't know how high it goes. It can be dangerous. Then after that is how they relate to prostate cancer, because many of the customer that we are working with, they are all at the age of 50 and then moving on to 60 and 70. And all that is actually all within the range of where they will potentially get prostate cancer. And prostate cancer chances is high. So today's subject will give you all awareness of that and help you understand how to help yourself to prevent, one, the high blood pressure. Two is food and type of activities you can help you to prevent your potential getting prostate cancer. And that is why this is a very, very good webinar. So we shall start, shall we? Thank you. Hey, thank you very much for joining us for the webinar. I think today will be a very benefit to think and understand our webinar, where it goes, and then you have a really good idea. So high blood pressure and prostate, what is the link? Okay. So first of all, let's talk about what is high blood pressure and then what is prostate cancer. And secondly, then we'll talk about what is the link between the blood pressure and prostate health and how the food and we can take and avoid to prevent your blood pressure and prostate health. And that is really something that you can help to take some of these food and lifestyle changes and definitely help you to improve your blood pressure and also your prostate health. And so in addition, at the end, we'll talk about what those sugar can help you, and then we'll conclusion. So I noticed today we have a lot of people, I don't know the name, there's 20 somewhat people here, 30 or so more, and they some of the names are familiar, some of them don't, but I really want to catch up. 4 stage of diabetes. The reason is because all these are related, most likely somehow have some link with the diabetes. So we have to get everybody to catch up. So usually in the first stage of diabetes, before your diabetes start, we'll have LDL cholesterol goes up. LDL is the bad cholesterol. When it goes up, it damages the B cells come out from the pancreas. The B cells will take sugar to the cells. So more B cell damage, more sugar is going to flow around the machine because it's not going to the cell for fuel. So the problem you're going to start because the LDL cholesterol, the bad cholesterol, and the sugar get together, the blood becomes thick and start forming plaques everywhere. The entire body start forming plaque. And very quickly, you move to stage 2. When all these plaque forming, your artery and your vein will become less space, so your blood pressure start going up. Now, blood pressure start going up, usually go up like 120 to 130, 130, 140, and on and on and on. So when you more plaques stuck together, and you'll be more blood sugar going higher and higher. Now, at this time, you might have no sign and symptom whatsoever. You continue the same old lifestyle, do whatever, same thing. Then very quickly, you move to stage 3, which is become a pre-diabetic stage. Now, in pre-diabetic stage, every doctor in the whole world, they measure the same thing. It's called HbA1c because everyone have a hemoglobin. And they measured a percentage of blood sugar attached to this hemoglobin. If you're 5.7 and below, you're a normal person. But you're 5.7 to 6.4, which is a narrow range, then you are pre-diabetic. Now, unfortunately, in pre-diabetic, your blood sugar will be, percentage will be 5.6.4. And doctors say, hey, you are pre-diabetic now. You got to really change your lifestyle, monitor diet, low carbs food, lower weight. You got to exercise. Now, they will tell you all these things because you're not going to give you medication because you're not diabetic yet. But unfortunately, majority of people, what? I will do nothing because basically you don't feel any pain, no signs of need to change. So you're same old lifestyle. And net result, if you don't do anything, you very quickly, in 2 to 3 years, you change to stage 4, which is your diabetic. And basically your A1C over 6.4. Now, we have many, many patients from stage 1 to stage 3, we can start helping you to really prevent you even go to pre-diabetic, because we have this product called Lowsutea, which is going to help you to lower your blood sugar, lower your cholesterol, and lower your blood pressure. And later I'll show you why that happened. But this is something that, on top of that, if we can help you to understand that you have no medication yet, but you need something to help you, then Lowsutea is your choice. Then you will have less chances to move to diabetic stage. And that's why we try to talk about, well, so why do you talk about Lowsutea then? Well, Lowsutea is a total, it's not a drug, it's just a food. Inside the two things in there, they call guava leaves, which help to delay the absorption sugar into the blood vessels. And then you have the bitter melon, which increase the insulin sensitivity, takes the sugar into the cells, and the bitter melon also, any excess sugar, instead absorbed to the bloodstream, they will dump the sugar, the cholesterol, and the salt from urine, dumped it out. And net result, you have lower blood sugar, lower cholesterol, and lower salt, and your blood pressure will come down. So your 3 high are coming down. Now, if your 3 high come down, the chances of you get really serious complication and much more lessen. Plus, during the time, you can able to start changing a lifestyle, and it'll take time to learn how to change lifestyle. This work together, then you will be much more healthier as you move on, and chance to convert to diabetes, it will be less. Now, even if you're diabetic, doesn't matter. You drink Lowsutea will help you to bring those blood sugar down and cholesterol down and blood pressure down. A lot of people were drinking their A1C is like 6 from 10 plus, 11. They brought it down to 6 and lower. So this is really, we have thousands of patients that are doing that, and they love it because it's easy, just drinking tea, and it's delicious. And so this is something that we can help you. Now, certainly, we don't want you to just drink tea, because in order to change your lifestyle, you several things. You need to, besides drinking tea, you need to take low carb diet, low fat diet. So we'll teach you all kinds of things to do to help you to do this low carb, low fat diet. Now, then also you have to exercise. You have to do 8,000 to 10,000 steps a day. So this is something that program can help you to also have that. Then you have to lower your weight, because your BMI is over 30, you have to bring it down to 23. And then weekly, we have a weekly doctor webinar, or doctor or nurse or me, webinar to teach you how to lower your weight, do exercise, and what diet take. So, and also different type of disease. So you learn about it, and will empower you to really try to help yourself to make sure do the lifestyle change. And that result, you can able to lower your blood sugar, cholesterol, and blood pressure, so you can be healthy. So we have all that now. The daily and the weekly webinar is totally free, no charge, just to help you to learn. And this is something we want to commit to help everybody to understand what your disease is going to be, and so you can able to empower yourself to track and understand. So we have many customers who are A1C is more than 10 plus. They brought it down to as low as A1C with 5.7. So we are very confident we can change lifestyle, because change lifestyle take at least 6 to 9 months to understand, to do, and to practice, and you have to continue the lifestyle. So this is something that is extremely exciting to help you to be better health. So let's talk about what is blood pressure, because a lot of people say, oh, blood pressure, why you have to do this? Now, blood pressure is very important, because you have your blood vessel, your heart pumping up, and then when the heart pump, boom, and then that's your systolic blood pressure. And then when the pulse went down and normal blood pressure in your blood vessel, that's diastolic blood pressure. So there are two types. One is called systolic, SYS here, you see. And there should be, this is high. It should be somewhere in the neighborhood 120 and below. And diastolic will be 80 and below. Cannot be this one. This is high. So it really shows how hard your heart is working, and more importantly, make sure you have to continue maintain low blood pressure. The reason is, if you're not, you have all kind of problem with heart attack, stroke, and so forth. So the blood pressure, in a way, that's always arranged during the day, if you're working, you're running, you sitting down, the blood pressure will be very different. If you're running, you're excited, your blood pressure can go up as low as high as 140 and higher. And you sitting down, the blood pressure can go down as 90 or 100, whatever. So it's all depends. However, you need to know if you're sitting down, the normal blood pressure should be less than 120. Now that's very important because that's is normal systolic blood pressure. That's mean the blood pressure with the heart pump, boom, and come back down as 120. And if now nowadays a lot of people worry about, hey, is my blood pressure high? Well, certainly if your blood pressure is over 120 to 129, it's still acceptable. If you're running exciting, no problem. Now, your diastolic remaining blood pressure is the blood pressure in the remaining vessels. The remaining vessels should be somewhere another 80, okay, or lower. Okay, this is the blood pressure continuous on the blood pressure in your vessels, 80. Now, this is important to continue to maintain low. The reason if you go high, that's mean your body is really stressed. So you continue high more than 80, and that can be a risk for you. So importantly, you can always maintain 120 over 80. That's the key, okay? However, when you have high blood pressure, what happens is due to different disease, could be age, whatever. And so now you are in a stage 1 hypertension is 130 or 129. In other words, your blood pressure start moving upward. Like for example, we talked about earlier, you have all kind of plaques on the vessels as pluck up, and your blood pressure start moving up. Usually that is what you see, 130, 139. And your systolic blood pressure will continue also go up to 80 over 90, and instead of staying under 80. So this is the stage 1 of high blood pressure, 130 over 139. It's a systolic. When the blood pump up, boom, your heart pump up and then come back down. The remaining blood pressure, 80 over 90. So then you have the stage 2, which is the high blood pressure now is higher than 140. Now, that stage 2 high blood pressure, that means you better go see a doctor now because you might need to have medication to control your blood pressure, bring it back down to under 130 or 120 range. So you need to do that. And on top of that, the diastolic higher than 90 now, 90 or higher. So that is no good because that's the time you really got to get medication control. And then the last but not least is when you get down to higher to be 180. In other words, your blood pressure continue over 180 for a long period of time, meaning a couple hours or even half an hour within, always 1 to 80. And then the diastolic is higher than 120. Now, that's the time that you need to start going to really the hospital because this is called medical really hypertension crisis now. Because anything over 200, you have a chance to have heart attack and stroke. So if in half an hour you are not bringing the blood sugar down, you got to get medical attention, okay? Give you some example. We have some elderly customer who husband and wife live together, but the wife forgot to take her hypertensive medication, her blood pressure medication. So the blood pressure continue to go up and up and up. Now, usually take typical hypertensive blood pressure. If you forget to take it one day, the blood pressure doesn't go up too high. But you forget for a few days, it'll go up and higher and higher. Every day will just go higher and higher. If you don't monitor it, you can go as high as 300. And then maybe at the time that you realize that at the time is you already got one of the vessels in your brain is not cannot handle it anymore and pops, and you now become a stroke, a CVA kind of cerebrovascular accident. So when that happened, then you have weakness on one side or kind of move certain thing, then you actually immediately go to the hospital, and that would be sad because recovery is very long. So we don't want you to have that kind of experience. That's why you have 180 and higher, you got to go hospital to make sure the hospital can give you very quickly with drugs to bring the blood pressure down. So that is very, very important. So remember your blood pressure. That's why you have to take a blood pressure, and do not forget your medication. A lot of people, when you get older, unfortunately, they tend to have less memory capacity. They forget medication, and net result, you will potentially, for example, forgot the medication, and that result, you may end up with a stroke. That'll be tremendous, detrimental, with long-term care, very expensive, or you get a heart attack, which you can potentially die. Okay, so really got to be careful on that. So this is something that you really have to remember. Got to go to the hospital and got to check if you have 180 or higher. Now 140, you got to go to a doctor already to get your using medication come down. Okay, so remember this. You can take a picture. It's good to take a picture of this so you can remember what's the standard. You may forget, so you have to take a picture. You can always remember this. Okay. So now let's talk about prostate cancer. Now you learn about hyperpressure. Now prostate cancer come along. Actually, the prevalent prostate cancer in 2022 in the World Health Organization is about 14.7 million new cases of prostate cancer worldwide every year. New cases come on, and it's fourth most common cancer worldwide. Okay, and certainly, we have a lot of old, not old men, but it's a lot of men, and many people, and it's, the typical measurement in many countries is every 7 men there's 1 prostate cancer. Okay, so that's a big number, right? And then there are 397,000 people who die of prostate cancer. Now the problem is a lot of people is they discover it's too late or they don't do anything. Now, and if you don't do anything, it's sad because you could treat prostate cancer and you can do well and maintain better life. And prostate cancer accounts to 7.4 all new cancer cases in 2022. So it's a big number. And consistently, 60% diagnosis occur in about age 65 and older. In other words, majority of people who say, hey, we have prostate cancer, and that usually around age 65. So now, if you are around this age group, like 65 years old, it's good to always check with the doctor. Hey, can I, take a blood test to see how is my prostate doing, or do an examination. And usually you might not get any symptom of prostate cancer. That's the sad part, because you basically have no idea you have prostate cancer. Or some people will have say, oh, okay, I do have some issue in sense of voiding, maybe difficult. But on the other hand, that doesn't mean that, you don't have prostate cancer. So one of the common tests is PSA. The blood test is PSA. Now, so you go to a doctor, you're 65 years old, you should actually generally tell the doctor, hey, can I have a PSA test? And maybe I could able to understand where we're at. If your PSA more than 1, if you have more than 1, usually if you have 0.004, that's okay. More than 1, you just got to start monitoring. More than 2, it'll be more monitoring. More than 3, you have to keep going. So all you have to continue to check. And the doctor who do this are usually called a urologist, specialized in the area of urology. So this is something that you need to know. And that's why I'll give you some idea where it is. Now, let's talk about a little bit what is a prostate cancer here. Now, there's 2 images here. This is the typical prostate, the urethra, with the urine, the bladder come down here with urine. And this is a gland. And the sad part is this gland eventually will have a cancer. This is the prostate. And the prostate, what it does is actually, it really, if we can get, when you get older, a lot of times it enlarge. And when it enlarge, then the prostate, because of the fact that the function of the prostate creates some of the semen fluid, right? So if people get older and the prostate become enlarged and it start pressing this urethra, which is the tube coming down from the bladder to get urine out. So a lot of these people have hard time urination. And they hard time urination, so then they have to go to see doctor to check, oh, is this a actual cancer or just only a benign prostatic hypertrophy, meaning that the prostate become enlarged, which is not cancer. Now, a lot of people have that. They might not be cancer, but they enlarge a difficulty. So a lot of time that they can use drugs or even certain procedure to basically cut part of the or shave part of the prostate up so they can allow the tube easier flow. But if they can find cancer cells in here, that you might have to consider quite a few things to work on very quickly. One is the surgical remove this prostate, or I get radiation therapy, whatever, but that has to come from a urologist. Now, so there are two things to remember. One, you might not necessarily have prostate cancer. You might have just an overgrown benign prostate gland, and that's one possibility. The second possibility, you do actually have a cancer tumor, which you need to remove this whole prostate gland. And that is something that you have to talk to the doctor to make sure understand you are not having that. So this is something that you can take a pictures also, because I think this give you an idea what does prostate look like. Okay. Now, if you do, unfortunately, you do have prostate cancer now. So that usually typically have 4 type of prostate cancer. But the most common prostate cancer is adenocarcinoma, which is the most common type of prostate cancer, which I think 70% of this cancers all come into this, okay? And then basically it's just originated a prostate gland cell, and which prostate is producing the fluid and semen. And then you have the small cell carcinoma, and then you have transitional cell carcinoma and other neurologic doctrine tumor and sarcoma. But the most common is this one, adenocarcinoma, okay, which is good. So at least now you understand. You have, the name, at least you are familiar with it. The doctor talk about, you understand what it is. But what's the risk factor? The real risk factor is age, because majority of the people who have cancer come out is the age between 65 and up. Usually around 60 and something, you start understanding, hey, there's some issue, I'm avoiding less, having had difficulty. Then you have to look whether you have, really prostate cancer. And also, typically also, unfortunately, the African American men tend to have a high incidence of prostate cancer. So efficacy can be the race that can be potential higher chances of prostate cancer. So family history, like the dad have it or grandfather, you might have it. And last but not least is a lot of the diabetic patient potentially also can have, because a high level insulin, which they work with. So net result, prostate cancer come kind of like the risk factor are these 4 major risks. So with that, a lot of people don't even know they will have prostate cancer, because many of them have no symptom, basically absolutely no symptom by the age 65. And usually, if the one who have symptom usually have frequent urination, they also uninterrupted urine, where they drip, 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 and they go flow a little bit, drip, drip, drip. Also, sometimes if they have blood in urine, that can be quite common in some of the symptom of prostate cancer, or they have pain in urination, and also the back, the hip, the thigh, shoulder have pain, or sometimes they're fatigued. And also some of them, they start onset of erectile dysfunction, in other words, they can't get up. And then also the leg and feet swelling. Now, these are some of the very typical signs and symptoms of prostate cancer. But majority of these people usually have no sign, basically. So it's always good to go to a doctor doing a physical checkup in age like 50 something. Ask for a PSA blood test to see whether you have actually this potential cancer cell in the prostate. So PSA is something you want to ask for. And a lot of doctors nowadays, family medicine, they will do that. So then you say, how to link with blood pressure to prostate health? Really? Okay. So as you know, prostate cancer, and there's a lot of study, they said they found people who have high blood pressure, they have 8% greater chance to get prostate cancer. 8%. So it is a higher percentage. So if you are already a hypertensive person, to high blood pressure, you really need to ask the doctor, hey, do I have prostate cancer? Can you check my PSA? So that will be a first thing to find. And so that all different study also show that if your systolic pressure over 150, meaning remember just now, with the blood pressure, the pump up, come up, and more than 150, then you have 35% higher chance to get prostate cancer. The chance will be much higher now, okay? So, and the worst outcome prostate cancer, high blood pressure, we have 40% high risk to dying when they have especially a high systolic blood pressure, 150 and over. So really, if you have high systolic blood pressure over 150 and higher, then if you got high hypertension, is considered a pretty hypertension, the chances to get high chance to get prostate cancer, but also those prostate cancer, you have higher chances to die from high prostate cancer. So that's why the link of high blood pressure is right there. So you really need to think about, hey, I must really continue to lower my blood pressure, not to over 139 or 130. I have to go back to 120 or between 120 and 130. That's it. And so then your diastolic blood pressure is, especially you have to lower your blood pressure to maintain your chances not to get high chances of high blood pressure and get prostate cancer. Okay, if your diastolic, meaning the lower blood pressure, in other words, the blood pressure remaining of blood vessel. Now, the another measurement is your diastolic, meaning your remaining blood pressure in the vessels is over 100. Now, normally is 80, remember, 80. So you have over 100. Now, you will have also higher chance to get prostate cancer. And also with that, you have higher risk, 85% of the person risk of death from prostate cancer because your blood pressure continues so high. So on top of that, because you are over your diastolic over 100, you also have other risks, which is like heart attack and stroke. So that's why, on top of that, because of that, your tumor also become much more aggressive in doing this kind of high blood pressure mode. So net result, you have, besides heart related, and the second threat is prostate cancer. And so that's why blood pressure is something that you really have to, maintain and monitor and make sure that it doesn't overblown, okay? Now, also people have high blood pressure, they tend to have frequent urination, and that result, the symptom, so you tend to need to go see a urologist to check. And also a lot of times that you have a large prostate size. Also, you most likely have high blood pressure in men. And on top of that, you have bad symptom and really difficult urination. So again, this is some of the things that you related to high blood pressure together with your prostate issue. Now, also you can see when you high blood pressure, also a damage on a blood vessel, and then you reduce blood supply to the prostate. And then because of that, you also cause inflammation of the prostate and also become abnormal growth. Now, poor circulation also lead to low oxygen level to the prostate tissue, and then maybe that's the reason also it causes the prostate cancer formation. So all that is more really getting you to understand why the blood pressure kind of really have to maintain and make sure protected, make sure not to go high. And also not with net result that you also have erectile dysfunction, we can't get it up. okay, because of blood pressure. And also medication you're taking might be also affect your high blood pressure. It also affect your medication taken to lower your blood pressure, affect the blood flow to go to your prostate, and so that could be also cause potential some additional prostate issue. So nevertheless, that's why it's so important. You want to continue to give good circulation to the prostate. So make sure that it good circulation and make sure that it doesn't affect the prostate. Plus, also with that, you have high the insulin. You have high insulin. It's also affect the contribute prostate cancer. Remember, we talked about high insulin is the hormonal change is also linked to the prostate cancer also. So that way, at least you understand, as long as you don't want to continue to have chronic inflammation, and net result, you cause a large prostate cancer or actually become a prostate become enlarged, and so net result that is important. So inflammation can be a effect eventually got to the prostate cancer. Net result, you also realize if you have aging, obesity, you don't exercise, and that tend to be also become a risk of the person who get high blood pressure. So net result, that also contribute to prostate cancer. So now we talked a lot about all that already, and we also realize there's hormonal therapy for cancer to be treat prostate cancer, but the hormonal therapy also can raise blood pressure. And also another thing is urinary problem, where you have prostate cancer or you have a enlarged prostate, and that will also stress the nerve system, and your blood pressure always goes up because you need pressure to get the urine out, right? So that will create higher blood pressure also. So the next question you may say, wow, a lot of issue, the important, I guess, to summarize everything is you have to, in many, many ways, to lower your systemic and diastolic blood pressure. The whole blood pressure has going down below 120, the best. If not, it has to be below 130, okay? Now, the key here is, well, if that's the case, how do I prevent that? Very simple. You have to have good food for getting good blood pressure and prostate health. So some of the things is you always eat a lot of salad, berry, large green salad, tomato. All these are antioxidant, and good food that give you better blood flow and lower your blood pressure. So a lot of greens, a lot of vegetable, and certain oats, brown rice, high fiber item is also can be very helpful. Plus the walnuts, nuts with omega, a lot of fish, not red meat, that will also support your good prostate health. And certainly you need to take a lot of good fibers, which is reduce inflammation and also help you to lower your blood pressure and protect against your prostate cancer. Okay, so really good food with green vegetable, nuts, oats, healthy protein with fish, that's really helpful. Now, also you want to avoid what? You don't want to get a lot of red meat or processed meat like bacon, sausage. Cut all that down. Make sure you don't eat a lot of char item, barbecue stuff. That is also create a lot of issue. Plus, you want to cut down your sodium food like canned goods, salty nuts, all that. Really gotta make sure don't take a lot of that because that will really get you to get more chances to increase your blood pressure. Remember, salt will actually move up your blood pressure. So keep that in mind. Cut down the salt, not to eat a lot. Plus, you want to cut down your sugar intake because like soda, candy, pastry, all that has to take that out. And then you want to make sure don't take a lot of refined carbs like regular white bread. Take really brown bread, a lot of bread that is made of now high fiber. and you want to cut out all the unhealthy food, fat like French fry, fast food item, and that also you have to cut down on alcohol, because alcohol is really harmful, especially you drink a lot of whiskey and so forth. That basically will increase your prostate cancer risk. So really got to take that away. Lifestyle changes. Now you have to do healthy diet. We'll talk about already. You have to do a lot of exercise. You have to make 150 minutes of moderate exercise every week, meaning every day 10,000 steps. And then you have a lot of hydration. And that is the reason why we create Lowsutea. Because Lowsutea, you have to drink 2 liters of tea per day. And the other liter, you have 3 liters a day. And 2 liters already Lowsutea, 1 liter is other drinks that you have add together. Now, if you have enough water, you definitely will get all the poison out. And with Lowsutea, all lower your blood pressure. And you basically improve more circulation, flush out the toxin out of the body through the urine, and give you better kidney function, because Lowsutea asks you to drink 8 cups of Lowsutea per day to lower your high blood pressure. All that are calculated to help you to lower blood pressure. So that's why we ask you to drink 8 cups a day of tea. You say, how come so much? Well, to flush all the poison out, you need that much water. If you don't, you're not going to get it, right? Now, also, a lot of people don't realize you got to manage your stress. You have to take vitamin D. You have to cut down on weight management. If you have BMI with 30, you have to cut down to 23. And in order to do that, you have to exercise, you have to diet. All that whole lifestyle change will help you to get better health. And if you're lighter, man, you'll feel real good. So at the end of the day, why we drink Lowsutea? Because you can help you to lower your blood sugar, the high blood pressure, and bad cholesterol. Remember, high blood pressure is a key factor you want to lower. And that's why Lowsutea can help you. And at the ask of the day, in conclusion, so the research show hypertension will affect your prostate health. In other words, the high blood pressure will actually increase the risk of prostate cancer. And or the second one is increase the risk that enlarge prostate, the prostate. And if you enlarge the prostate, it will constrict your urine coming out. And that's why you might have to shave it up or cut part of the prostate out, but it's not cancer. But importantly, you just keep in mind, high blood pressure will create both potential prostate cancer or enlarged prostate. And you have to keep your blood pressure under control, and make sure to protect prostate health. Now, secondly, how do you do that? Very simple. You have to eat right food, which is like a lot of greens, a lot of high protein with omega, fish, not red meat, not processed food, meat. Eat a lot of fibers, brown rice, and no processed food like French fries and so forth. And all this food, excuse me, will help you increase the blood flow, reduce inflammation, balance the hormone, and give you less chance of risk of prostate cancer or enlarged prostate. Now, because of good eating, you can do DASH diet or Mediterranean diet, can improve overall being. And now some of the food can raise blood pressure, which is like salt, fish, chips, things like that. You gotta cut that out, because that will just give you more potential cancer risk because it causes inflammation and also hormone imbalance and poor circulation. And last but not least, very important, you have to drink a lot of Lowsutea to help you to decrease your blood pressure, improve your prostate health, improve blood flow because you have a lot more fluid around. You remove the toxin out through your urine. It supports your kidney. And Lowsutea is one thing to help you lower your blood sugar, cholesterol, and your blood pressure, and decrease your prostate cancer risk. Today is my lecture. Basically, give you a very overall, help to understand what a prostate cancer. And the important is really lower your blood pressure. Keep that in mind. Lower blood pressure will help you and lower your chances of prostate cancer or large prostate. And importantly, you got to remember, have the good food, not processed food, to intake, exercise, and drink lots of fluid, lot of Lowsutea. Best is got 2 liters of Lowsutea per day to flush out your poison, increase the circulation. Net result, you're better off to be much healthier. If you have any questions, do ask me. Write to me, Andy, ANDY, at WAHFONG.com, Andy@wafong.com, or write WhatsApp 852-6792-8891. This will help you to better, in case you have a question, we can definitely help you to understand, some of the issue you might relate to your blood sugar, cholesterol, and blood pressure. Okay, I hope that you have a wonderful experience with understanding now how to protect yourself with prostate cancer, and understand that you spend some time with us and try it. Already, many of you guys already experienced Lowsutea. Definitely will help you to lower your blood sugar, cholesterol, and blood pressure. I hope you continue to be healthy, and our mission is to help you to be healthy and make sure that you continue to be working on it. I'm really here to empower you with many of this knowledge so you can be better, better health. So thank you again. We'll see you next week, and hopefully always in good health. Take care. Thank you very much. Thank you for listening to the lecture. Take care. Bye-bye.